Good morning, everyone, and welcome back to Morning Rounds. Today's topic is, does this patient need a biopsy? But before I begin, I would like to make two comments. The first is that I'd like to dedicate this video to one of my followers, Sylvia Logan, who I met on LinkedIn. Sylvia has been following me for several years, and she always leaves very thoughtful comments on my blogs and posts, although she doesn't always agree with me. But her comments are always thoughtful and respectful and warm, and I'm very grateful to have her as a follower. So this video is dedicated to Sylvia, who lives in Ottawa, Canada. The second comment is that I was at the gym at 8 o'clock this morning to work out with my personal trainer, Charlene Cercile of Broncos Gym, and I'll leave the link below. Charlene is not only the world's best fitness trainer, but she's a fashionista on the order of, say, Carrie Bradshaw, only probably better. Charlene is hot on what's new while everyone else is still warming up. So when I got off the bike after 10 minutes of warming up in preparation for my routine with her, she looked at me and she said, "I saw your video last night. Keep the red lipstick and lose the glasses. We need to see your eyes." So here they are. I'm very grateful to have Charlene as a personal trainer, very grateful to have Sylvia as a follower as well as other followers, and I think you might be interested to help us answer this question: does this patient need a biopsy? Well, who is this patient? Let's call her Melanie. And Melanie is, say, 60 years old. She is actually one of the 10,000 plus patients that I've had in my practice the past 21 years. Melanie was treated for breast cancer. This is not her name, by the way. Melanie was treated for breast cancer this past year. She elected to have a mastectomy. She did not require chemotherapy. And her medical oncologist gave her an anti-estrogen, which she will take for 5 years. She came to see me for a second opinion and said that she was feeling completely fine. On physical examination, there was some nipple discharge from the remaining breast. And I asked her about that, and she said yes, she'd been having spontaneous nipple discharge. She'd had it on a couple of occasions. She had mentioned it to her medical oncologist and the radiologist. No one seemed to be concerned about it, but I was very concerned about it. So I examined her closely. There was no evidence of a mass. There were no enlarged lymph nodes anywhere. There was no evidence that the cancer had recurred in the area where there was the scar or on the chest wall. And so I ordered a mammogram and ultrasound, and they were completely normal. And she came back about 2 weeks later and she said, "I'm still having that nipple discharge." And we looked again, and sure enough, there was a single duct in the remaining breast that was producing this nipple discharge. There was no blood associated with it. And her mammogram and ultrasound were completely normal. So I said, "I'm still pretty concerned about this. Let's do a breast MRI." Fortunately, the insurance company approved it. We did the breast MRI, and the breast MRI was completely normal. So she came back to me and I said, "I'm going to recommend that you have a breast biopsy. You continue to have this spontaneous nipple discharge. There's nothing else that we can find that seems to be abnormal, but this is a symptom that I believe warrants a breast biopsy, which is to say, to remove that area of the breast where the duct is that is producing the nipple discharge, and to have the pathologist look at that under the microscope to make sure that there are no breast cancer cells there." And she again said, "Well, my radiologist says everything is fine, and my medical oncologist says everything is fine, and I respect their opinions, but I disagree. I think she needs a biopsy, and this is why." To begin with, it's the standard of care. Now, that's not much of an answer, but the question is, well, why is it the standard of care? As it turns out, this has been the recommendation at least since 1991 in the breast cancer textbooks, because there are women who will present with breast cancer and their only sign is a nipple discharge. It can be a bloody nipple discharge or not, but typically it will be a spontaneous nipple discharge from one duct of one breast, and even though the mammogram and the ultrasound and everything else is normal, there are no masses, etc., this can be a sign of breast cancer. As a matter of fact, in one study, patients who had already had breast cancer, like Melanie, who presented with a nipple discharge, such as she has, had breast cancer in a third of the cases. And in some of those cases, the nipple discharge was a sign of very extensive breast cancer. So her risk of having a breast cancer that's completely hidden, that's only presenting to us based on this nipple discharge, the risk is not high, but it's not zero. And I think it would be worth her while to give her the reassurance and to be absolutely certain that she does or does not have a breast cancer that is presenting only as a single nipple discharge. Again, the risk factors are women who are over the age of 50, women who have nipple discharge that's bloody, women who have a nipple discharge which is spontaneous, so they're not manipulating the breast, it's just sort of coming out on the bra or the nightgown, women who've had a history of breast cancer. These are some of the things that should basically raise a few more eyebrows with regard to the decision to move ahead and do a biopsy, even if the mammogram is normal and the ultrasound is normal and the breast exam is normal and the MRI is normal. You don't want to take any chances in any patient, but particularly someone who has already declared themselves to be high risk by having a breast cancer. So that's all for today. I hope that's helped. You can please like, comment, follow, subscribe. You know the drill. And if you would like a complete diversionary change of pace, I will post a link to a video published by Lisa Eldridge, who is a red carpet makeup queen, on how to apply red matte lipstick. Thank you so much. Thumbs up to you and thumbs down to breast cancer.